Well, about half of all adults suffer from chronic health conditions that can really take a toll not just on the body, but also on the mind. WNCN's medical expert, Dr. Kevin Campbell, joins us right now. And Doctor, you've been telling us during the break that nearly 7% of all Americans, they suffer with chronic diseases. They also harbor severe depression. Is that right? And how so? And what is depression?
So first of all, depression is a clinical syndrome where we have loss of appetite. You may have a situation where you don't enjoy the things you normally enjoy, overwhelming sadness, feelings of hopelessness. And what we find is that patients who have chronic illness, particularly heart disease, diabetes, and other chronic illnesses, actually have a significant high rate of depression. Nearly 40% of patients with heart disease actually are depressed, and that can really impact the course of their disease.
Absolutely, and there's also a new study out that you know all about. Tell us about the link that it explores between depression and heart disease.
In this study that was presented last week at the European Society of Cardiology in Spain, they looked at about 150 to 200 patients who were hospitalized with heart problems. And what they found was almost 30% of these guys were depressed. Then they looked at outcomes, and they found that 5 times the death rate in patients that had depression as opposed to other patients. And if you did not have depression, you were 80% less likely to die from your heart disease.
You know, and dealing with depression is sort of like taboo. It's difficult for patients out there to talk about with their families. So what should family members who maybe recognize some of these symptoms, what should they be doing?
I think the most critical thing is to recognize the signs and symptoms of depression early. It can be difficult in chronic disease because a lot of the symptoms, fatigue and just not feeling well, overlap. But if you can intervene early, report it to your doctor, get some help. It may not be a pill, it may just be some counseling. And then you can manage your depression and actually better manage your disease. 5 times the death rate if you have depression and heart disease. It's a wake-up call for me as a physician and for all the patients and families with heart disease out there.
But the good thing is, after you recognize it, there are ways to deal and cope with depression.
Absolutely. We have great drugs that you can take, but also we have talk therapy that tends to work absolutely fantastic in the right patient. It's all about taking control of your illness and making sure that you also don't forget about depression.
That's very important. Dr. Campbell, thank you for all those tips. And if you have a medical question for Dr. Kevin Campbell, it's easy to reach out to him. You can log on to WNCN.com and go to the links that we mentioned. There you can find Dr. Campbell's website. You can also find him on social media as well as Twitter. That's right.